Hello and welcome to Dragon Bytes, the pediatric podcast aimed at pediatric trainees or anyone interested in child health. I'm Assim, one of the pediatric trainees here in Wales and one of the presenters for Dragon Bytes. This week is the first in a new series of podcasts, our career pods, aimed at helping trainees apply to and interview for different grid subspecialties. So, if you're planning to apply this year, or even if you're earlier in your training and just wanted some more information on what different subspecialties have to offer, have a listen in now. To kick things off, our first episode is about paediatric emergency medicine, or PEM. I'm joined today by Michael Fox, one of the PEM GRID trainees currently working in Wales, and by Hannah Murch, a PEM consultant based in the University Hospital of Wales. We discussed what drew Michael into PEM and how to improve your grid application with an aim to get shortlisted for an interview. Anyway, let's get started. Hi everyone. I'm here with two fantastic people, two of my favourite people ever. Hannah Murch, who's one of the Peds ED consultants down in the University Hospital of Wales. Hi, Hannah.
Hello. Did I pay you to say that?
No.
Oh, I'm easily bought.
Yeah, amazing. And then, of course, we've got Michael Fox, who's one of our PEM GRID trainees in the University Hospital of Wales. Hi, Michael.
Hi, Assim. Thanks for that introduction.
Well, I think it's well deserved from you both. So, what we're hoping to chat about today is a bit about applying to PEM and PEM interviews. But I thought it'd be really nice to get to know the both of you first. So, can I start with you, Michael, as I've got you on your own home computer? So, could you tell us a little bit about your career in medicine today? You know, where you studied, what you did, and where you got to where you are now.
Sure. So I did my undergraduate medical degree in Brighton and Sussex Medical School, and then moved from there to do my foundation years and paediatric training in the Severn Deanery. I also did a clinical teaching fellowship based between Bristol and Gloucester, and that was linked to the University of Bristol Medical School. And having spent most of my paediatric training in Severn, I then applied for PEM GRID training and was allocated a training post in Cardiff that I started the end of last year. And that brings you pretty much up to date with where I am now.
Fab. But what was your teaching fellowship year? Out of interest, what was that in, and what did that involve?
So it was primarily an academic post. It was teaching medical undergraduates from years 3 to 5 from the University of Bristol Medical School, along with working with the Simulation Centre at Gloucestershire Royal Hospital. And we did simulation, we did seminars, clinical teaching, we did some lecturing at the University of Bristol, and then quite a lot of medical educational research as well. It was an absolutely fantastic year. It's the year to get CV from zero to hero.
That is a great selling point for a teaching fellow.
Oh no, it was a fantastic job, and they were a great bunch up in Gloucester as well. Yeah, really, really good. I'd thoroughly recommend if you can get a teaching fellowship or an academic job, just something that gives you a bit of time out of full-time clinical medicine. It just gives you a bit more perspective on other parts of healthcare and training and different ways of working. And you get to meet some people that you wouldn't necessarily meet if you just did clinical jobs. So yeah, couldn't recommend it highly enough.
Oh, brilliant. So you're a PEM GRID trainee now, so that must have meant you started your paediatric post a fair few years ago now. What was it that drew you into paediatrics originally?
Well, interestingly, I didn't actually always want to be a paediatric doctor. I actually wanted to do internal medicine, and I had applied for and been offered a job in core medical training. But in the process of applying for core medical training, I undertook a paediatric training post in my F2 year and had a really great time. I realized that in pediatrics, you had that full breadth of clinical medicine, not dissimilar to general medicine in adults, but obviously within a much more senior-led, a much more supportive environment. And I realized that I felt that I fitted into a pediatric team far more than I was fitting into the adult teams. And I've always believed that every area of medicine is very interesting and that people choose their specialty based on where they feel they most fit in, and that's how I felt when I did my pediatric post. And I felt that strongly enough that I turned down the CMT post and then reapplied for pediatrics for next year.
And we're really great to have you here, and thank goodness you dodged the bullet that is adult medicine.
That's what I was just thinking.
It feels like a pretty good decision right now, yeah.
So, at what point did you think, do you know what I need to do is pediatric emergency medicine? What drew you into that?
Well, throughout pediatric training, I'd always found that I most enjoyed the high acuity cases and patients, and just by fortune, in my general pediatrics placements, especially as a registrar, I ended up seeing a lot of sick patients, a lot of HDU patients, and spent a lot of time in resus when I was on call. And so I, from that, started to realize that pediatric emergency medicine was something I was interested in and hopefully played to my strengths, because I'd had quite a lot of feedback that I was good to have around in emergency situations, that I was very calm and very considered, and that people really liked that. But I hadn't actually really considered about applying for PEM GRID until quite late towards the end of phase 2 training. And it came about after a clinical case that I had of a child that ended up being managed on our ward with a major trauma. And my reflections from that case were that here was an area where I felt like I could make quite a big difference to the care of children. And I wished there were lots of things about the case that had gone differently. And so I decided that I would apply for PEM GRID in the hope that I could develop the skills in order to bring those to whichever department I worked in the future, and try and make sure that the things that I would have had run differently in that case were different in future wherever I worked.
I mean, that's incredible. That's really commendable that your thoughts are more aligned with what is it that I could offer the specialty, rather than what the specialty can offer me.
I mean, I think there's always got to be both of those things. I think that's really important, because you also have to enjoy the specialty that you're in. You can't just be give to the specialty. And I think one of the things that I've learned from working in pediatrics is that I require a certain amount of immediate feedback from the patients that I see in order to feel positive about what I'm doing at work. And at least in emergency medicine, you get lots of small wins through the day, and that's quite gratifying. So it's not all just about give, but obviously a lot of my motivations were about finding an area of medicine where I felt I could make a difference, because in terms of my satisfaction in the way I work, I quite like to feel that strong sense of purpose.
Well, that's incredible. And I agree. I think PEM seems to draw people who do like relatively fast gratification with the work that they're doing. You're now a year into your PEM training post. So far, what have you found to be like the most rewarding part of your job?
Well, I think there are many ways that it's what I expected, insofar as it continues to be a very broad specialty with a very good range of presentations that you see. It's nice on some days that you can be quite independent with your management and the patients that you see. I still think the case mix is excellent. I don't miss clinics, which I used to find a bit tedious, although a very important part of the system. I just didn't think clinics were particularly for me, so I haven't missed those. And I still enjoy all the emergencies and working with the kids and families.
So I think the next thing that I really want to have a chat to the both of you about is, I'm sure there are people who are listening to this at the moment who might be thinking about doing PEM, but they might not have the clearest idea as to what the grid training fully involves and what other factors they'll need to think about, in the actual, training part of a PEM grid post. So an open question to the both of you: what does the PEM training grid post look like, and what does it involve?
Do you want to go first with that, Michael?
Yeah, sure. Why not? So PEM grid training is usually over 2 years. Involves 6 months working in the pediatric emergency department, followed by a 6-month pediatric intensive care rotation, and then a secondment period, which involves going to allied specialties in order to gain the additional skills that are required in pediatric emergency medicine that you might not otherwise gain in traditional pediatric training. So that might be additional surgical skills, spending time with ophthalmology or in dental clinics or in fracture clinic to gain experience, especially of major and minor trauma. And then there's usually a 6-month stepping up to consultant period back in the pediatric emergency department. And that's all mapped to a curriculum, which is found on the Kaizen e-learning portfolio platform. And you link your evidence from that 2-year period through a selection of SLEs, feedback, reflections, etc., very similar to the training that pediatric trainees will be familiar with. And it's assessed yearly at a progression meeting, which is run nationally through the CSAC. And you continue to have an ARCP within your deanery each year as well to look at your progress. And prior to completing your CCT, you still need to do a start assessment that is tailored towards your grid. And then you apply for CCT in the conventional way.
That was a really good summary of basically everything there. Did you have anything to add to that, Hannah?
No, I think the secondment bit varies between different training centres. So some have kind of a fixed time in surgery and orthopaedics. Some kind of just allow their trainees to kind of dictate what they need. Others, I think, have also some time in anaesthetics. But it's not kind of, as long as you get the competencies you need, there's no kind of set format. It's very variable depending on what training centres have and that sort of thing.
Okay, cool. I think what we'll do is try and get into the sort of application process proper now. So I didn't realise this at the time, but we are now probably less than 3 months from the deadline for grid applications.
Dun, dun, dun.
I know, can you believe it? So what should we start with you this time, Hannah? So what advice would you offer to trainees in general for applying to grid?
I would talk to PEM trainees or any grid trainee that's already doing it. You almost want a wide range. The ones that have just got the PEM job. So, for example, someone at Michael's level who's in their first year of PEM. I'd probably speak to someone who's just coming out the other end, reaching CCT of their grid, and then speak to a consultant who's been doing the job a few years, just so you can kind of see what they've all done in there and kind of what experience you might need leading up to it and what's important to kind of draw out in the interview. Because there's obviously lots of guidance on the RCPCH website, but I think the best thing to do is talk to people that have already gone through it. And it's the kind of thing that you lose memory of quite quickly. So like I obviously applied for my PEM grid job in 2013, and it's amazing in that time how much changes and how much you kind of forget what you needed to do. So, but I think having different trainees at different time slots is probably a good idea to try and get as much information as possible.
That's really helpful. Mike, did you have anything to add to that?
No, I just want to echo, I think it's really important to talk to as many people as possible, be that trainees or consultants in that area, and to remember that the training is only the 2 years that you do to get to be the consultant, and it's really important to have a good idea of what being a consultant will look like, because that's the job that you'll end up doing for a long time.
Yeah, I think sometimes it's quite easy. Perhaps not so much in PEM where you work quite closely with the consultants, but in other specialties where you're much more shop floor based and you don't see much of what consultants are up to, that you end up falling in love with the job you're doing at the time and not with the job you will be doing afterwards.
Yeah, definitely. And I think it's also important to think about kind of life as a whole without sounding philosophical, but like obviously look at what centres do the grid that you're interested in, because it's quite a big undertaking if you want to do a grid that's not available locally to you, and therefore if you've got a family or and they've got jobs. So it's just important to think my number one goal is I want to do PEM grid in Cardiff, but is my number two goal I will move to London for it. I think you just need to be quite clear from the beginning of what your boundaries are for yourself. Do you want to move for the job, or do you only want the job if you can have it locally? Those sorts of things I think are really important to think about before you go into it as well.
That's really helpful too. So say someone's now decided, okay, I'm going to commit and apply for this. How can a trainee sort of maximise their chances of getting shortlisted for an interview? Should we start with Michael this time?
Yeah, I think that's a really important question. I think once you've decided that you're going to apply, you first of all have to do some information gathering. So the shortlisting criteria, I think, are published online. So you can normally search the RCPCH website and find eligibility criteria and what they're looking for in the candidates. And then this would be your framework to work from when you're looking at your application. And that's a good place to start. And then I think it's worth talking to consultants, anyone who perhaps has had previous experience with interviews and short and long listing, to find out whether there's specific documents that they'd recommend looking at. And there are plenty around, again, mostly through the RCPCH website. And a good example for PEM is the Facing the Future Standards for Children in Emergency Care document that was published June 2018, because that will give you most of the key issues that you might want to talk about in both application or interview. But there are also others, and that will be dependent on each individual person, what their interests are, and how they interpret the personal specification.
Oh, excellent. Thank you, Michael. Hannah, do you have anything to add to that?
No, I don't think so. I mean, I guess in terms of scoring points in PEM, it's important just to totally sell yourself and not forget things you've done. So teaching and education and running. So obviously you can teach locally and then think, have I then done something that's a bit bigger than that? Have I ran my own study days? So kind of just think outside the box slightly, because we've all done stuff, but sometimes you forget about it, which is ridiculous. So don't just think about the teaching that you've done locally, but have you then done something for your deanery? Have you set it up for multidisciplinary? Those sorts of things are good for the application, because it just shows different levels of the same thing, if that makes sense.
Yeah, absolutely. And in fact, that works into a really nice segue into what my next question was going to be anyway, which is how can trainees improve their score on the application?
So that would be one good way of making sure that you kind of elaborate as much as possible on the each topic. And the good thing about PEM is that most things you've done are applicable to PEM, so don't leave things out either. So if you've done any say quality improvement or audit projects with NICE for fever or UTI or neonates, anything really can come through the front door of the emergency department. So it's really important to include all of that. As I said, they love teaching. Presentations, publications, obviously people worry about all of that sort of side bit, but I wouldn't worry too much. You're talking about 1 or 2 extra marks for that. And I was someone who didn't have that many kind of publications and presentations at all. So don't sweat the small stuff either.
Fab. Michael, did you have anything to add to that?
Yeah, I think that when you look at the way applications are long listed and shortlisted, there are things that you can easily change and things that you can't easily change. So things that you can't easily change, especially if you've only got a short period of time before applications, might be whether you've got a publication, whether you've got a master's degree or a PhD, because there are various preset categories from your past training and experience that will get you points on the application. But then there are also white space questions as part of the application, or there certainly were when I applied, that fell broadly into some categories. So they have the patient and family-centered approach, management of acute pediatric and neonatal emergencies, common practical procedures, quality improvement and audit, management and leadership experience, research experience, education, and then a statement in support of your application. And all of those are boxes that come with a briefing, and you write your white space, and then those are scored and provide you with extra points. So even for those potential applicants who might look at the previous things they've got and think, oh, I'm not sure I'm going to score particularly highly on those. Most doctors, I suspect, most pediatricians looking at PEM will be able to complete these white space questions, and if they do a good job with those, will probably be able to score lots of points. So I wouldn't discourage anyone from making the application just because they look back at what they've done and think, oh, I don't have a PhD and I don't have loads of publications and presentations, because that's only one part of it.
I mean, that's really encouraging to hear from the both of you that you don't have to be a PhD student in order to apply.
Otherwise, I wouldn't have stood a chance, Assim.
No, me neither.
Fine. So I suppose the last thing when it comes to applying, and I think things that a lot of trainees worry about in the background, particularly with something like PEM, where you might well never have had a job in it, and it might be impossible, even locally, to give it a try. So I suppose that it really breaks down into two questions. Is having experience in pediatric emergency medicine essential prior to applying? And whether it is or isn't, are there any ways that trainees can go about to gain experience in pediatric emergency medicine if it's something they're considering but they want to try first before they apply?
So I don't think it's essential that you've had experience in peds emergency medicine beforehand in terms of the application process. I think it's useful because you're doing the job for a long time, so you want to know that you like it. So I guess the ways that you could get experience are we're a friendly bunch. Just approach any of us and ask for taster days. Have you got any projects that I could do with you? And just get involved in that way. Obviously, if you work in a department that doesn't have any peds dedicated staff in your emergency department, just go and approach them. And another department that does, and I think wherever you work, most people would be more than happy for you to come and spend some time there, observing or anything like that. But obviously think about all the experience you have got, because you will have been to resus, you will have seen acutely unwell children, you will have got called down to a trauma call, and all of those is very useful in kind of building experience up. So I don't think it's necessary, but and it is quite difficult sometimes to gain. The other things that are really useful are kind of if you teach on APLS, all of those things are good kind of experience and definitely useful for your application process.
Oh, thanks, Hannah. And same question to you, Mike. What are your thoughts on it?
Yeah, I think I agree with everything that Hannah said, and I also think it's worth remembering that if you're applying for a grid specialty post, then what you're trying to demonstrate is that you'd be a good candidate to be trained to become the specialist in pediatric emergency medicine. It's not expected that you already have all those skills completely to begin with. And much like Hannah said, I think, especially in general pediatrics, you're going to have plenty of access to acutely unwell children that will furnish you with many of the skills that would be required to meet the personal specification of a PEM application.
Excellent. Fine. So in summary, I suppose the answer would be it's not in any way necessarily essential to have had PEM specific experience, but trainees might well have had experience that's very closely PEM related anyway. And even if it isn't necessary, if you can get some PEM experience or some taster days, that's helpful just to solidify your feelings towards it. Does that sound like an accurate summation?
Yeah, I agree. Because otherwise, you're applying for a grid job that the minimum is two years, but you're looking then at a career forever. It's quite a big deal if you've never done it at all to kind of carry on with that. So I think it'd be good to just spend some time down there, because other people, I guess it's the flip side. I love PEM, but the flip side is true that some people might find it doesn't work for them, kind of the shift pattern or the busy kind of rushness of it. And it's important to explore that as well by spending time in the department speaking to the consultants, because you might think it's for you but actually think, no, this is not what I want to do for the rest of my life.
Excellent, thank you.
And I think the other thing to say is that whilst it's, I think, probably great if you can get some experience in specialty before you apply, it shouldn't stop you from applying, because the key, I think, or one of the key skills for a written application or an interview is not that you've already done the specialty, it's that you can take the experiences that you've gained elsewhere and draw on those to apply them to the specialty to which you're trying to gain access to.
Brilliant. Okay, that's really helpful. Thank you, Michael. So I suppose before we move on, did either of you have any final thoughts about the application process and things that trainees can do?
Yeah, no, I don't think there's anything. I think there's plenty of stuff that people can do in terms of lots of resources that they can read and look at, but that's probably not good to have on a podcast as just a list of things.
Sure, yeah. Okay, cool. Well, just in case they do want a list of things, what are your thoughts there?
Yeah, I'd say as part of the bare minimum, I would download the personal specification for the grid post that you're applying for. I would have a look at the Facing the Future Standards for Children in Emergency Care Settings document. I think it's worth having a good overview of the structure for the NHS, and the King's Funds do quite a good summary document of that for how the NHS is funded and fits together in England, but it is different in Scotland and Wales. But I think that's an important part of understanding the way the healthcare system is put together in the UK. I would recommend looking at the NHS Leadership Academy, and they have some really good documents on the leadership. They have a leadership framework document that, once you read it, I think can provide a really useful way for thinking about how you answer some of the questions, because it's very structured, and that's both useful, I think, at interview and when you're doing your written responses to the questions that you do in the application. And then I think you should have at least 1 or 2 papers that you could talk about that will have changed your practice in some way, because that is quite a common question to crop up in interviews, if not grid, then just in interviews in general. It tends to be quite a popular question.
I tell you what did come up in my interview was a paper which I can't remember now, which is why I'm really not good at quoting papers. But it was about why paediatric emergency medicine consultants are a good idea, about like reducing waiting times, reducing admissions, and kind of increasing satisfaction from papers. Can you remember the paper, Michael?
Well, I got asked an almost identical question about do I think that we need PEM consultants in emergency departments, and I basically based my answer on the Facing the Future document.
Oh, okay, so maybe it's been incorporated into that now. But there is quite a lot of evidence out there of why having paediatricians at the front door is beneficial for patients, staff, the hospital, the community. So it's probably worth having a read through some of those papers. If you're anything like me and you forget the name of the paper, as soon as just kind of talk about it in broader terms. But it's definitely worth having a read of that sort of stuff.
Brilliant. Lovely. And thank you to Michael and Hannah for the fantastic advice they've given us there. Both Michael and Hannah are happy to be contacted via Twitter. You can find Hannah with the handle @HKMurch, which is spelled @HKMURCH. And you can find Michael with the handle @Dr_MJFox. That is @DR_MJFOX. We'll be bringing you their advice on interviews soon, but prior to that, we're planning to get out all the podcasts we have on applications for you, given that the deadline for that is sooner. In the meantime, thank you for listening to Dragon Bytes.